So what are the environmental factors that can influence the microbiome?
Okay. So probably the most important one that everyone remembers is that the mother's dental health, her oral microbiome, will determine the placental microbiome. So as the baby's developing and as the placenta is developing, the uterus and the uterine environment, the microbiome there is influenced by the digestive system, not so much the oral microbiome, but the placenta is influenced by the oral microbiome, and the species are quite overlapping and quite specific there. So it's really important to be looking at it and optimizing her digestive health, her oral health, because if there are any things that are interfering it in a negative capacity, then the bacteria that are what the baby is growing in will then obviously be out of whack. But they shape the child. They literally will shape, what the immunology of the environment, whether or not implantation will happen, whether or not immune conditions will be triggered, or the genes around those immune conditions will be set off for the child. And the stability of the microbiome determines whether or not she has a miscarriage. Everything that she's exposed to will affect it. So toxins, environmental pollutants, poor dietary choices, stress, the people that she associates with, her partner's microbiome, just sleeping next to them, let alone intimate contact. All of those sorts of things will affect her microbiome, which will then affect the babies. It's not a sterile environment. Everything that we do will affect it.
Love that you mentioned the oral health piece there, Leah. You can come on the podcast anytime you like.
I remember seeing that research probably about 8 years ago, and it was that beautiful paper. I don't even know if I've shared it with you. And it looked at the placenta and the oral microbiome, and then it was followed up. And I was like, that was the first paper that came out that made us certain that the placenta was not sterile. Because for so long we've been telling women the placenta's sterile, the whole environment's sterile, nothing passes through. And then that paper came out, and it was just like, you're all, yeah, there you go. Here's some science. Everything.
I'm gonna hunt for that.
I'll send it to you.
Thank you very much. And Leah, how do vaginal and C-section births differ in terms of influencing the infant microbiome?
I'd love to say that they don't, but they do. I don't want to do any cesarean section shaming of women. I'm all for, birth choices and medical needs and all those sorts of aspects. But we know that a child that's born vaginally versus a child that's born by a cesarean has a different microbiome. But we also know that about 6 to 8 weeks postpartum, those microbiomes are almost identical if the baby's breastfed. So, that historically it was that whole idea of babies are born and their gut is sterile and they've got no microbiome. We know that's not true. We know that the placenta, her digestive system and the uterine environment influences their original microbiota, but the swallowing of the species through the vagina and around the anus as the baby's coming out sets up all sorts of different things on their skin. And, like a baby's skin is incredibly permeable for a reason. It's covered in that vernix for a reason, so that it absorbs more of the microbes when they have skin-to-skin contact with their parent. And then we don't want to wash off that vernix so that it's consistently going right through their skin and building up their resilience. Cesarean deliveries are very different. They'll often wipe the baby, they'll wash the baby. They may or may not have skin-to-skin contact immediately after, depending on the type of surgery, but they certainly aren't exposed to the vaginal environment. And then that always brings up the question that women always ask, which is, should I do vaginal seeding, which is inserting a gauze into the vagina and then wiping the baby's face with the secretions from her vagina? There's mixed opinions around it. And the recommendation that I sort of always say to people is, there's a few papers that came out that showed that because the vaginal microbiome changes as the baby's descending the vaginal canal, and so we know that the species change right through the whole pregnancy, but it certainly changes literally like centimeter by centimeter as the baby's coming out of the vaginal canal. And if there's no stimulation of that canal, the species are very different. And we know that the immunology of that environment and the protective aspect of that environment changes so much as the delivery continues. So let's say hypothetically a woman delivers by cesarean, but she actually also has, genital herpes or something like that. There are cases of women giving genital herpes to their baby because that microbiome change didn't happen. It's just something to think about. So what I always say to people is have baths with your baby. We've actually got really good microbiome bath studies that came out that talk about the alpha microbiome in the family, or that talk about you can put 4 children in a bathtub and one child will have the alpha microbiome, and then all 4 kids match that microbiome. And so you're of mum and bub having lots of baths together, or dad and bub having lots of baths together, actually help to build the resilience within the child quite significantly.
So you wouldn't do the gauze swab, you just go the baths. But what about the makeup of the baths? I mean, if you were just putting a whole bunch of soap with all these like foaming agents, is it just the clean,
Just
like
water.
just water? Yeah.
You can do a bit of salt if you want, but the idea as well is remembering that the baby's skin is so permeable. You don't put anything on a baby for as long as you can, really, unless they have a crazy bowel movement. You just don't wash them with any soap or anything, and you let their skin start to develop the right bacteria to protect them for their life.
Yeah, I just thought I'd point that out before people started running a bubble bath.
Good point. It's a good
Yeah.
point. Thank you for helping.